Okay, this is abdominal assessment of a patient. When you're gonna do assessment of the abdomen, you gotta be sure you have the equipment required. So first you need a stethoscope, you need a pen or a marker, and you're gonna need a hammer, reflex hammer, or just a tongue depressor to evaluate the reflexes of the abdomen. Also, you might need a pillow to put it under the knees to relax the abdominal musculature. Before you start your assessment, you should be sure that the room is warm, that you have a good light, and also you're gonna ask the patient to empty the bladder before the examination. And once the patient comes, you're gonna ask him to lie supine on the bed with the arms on the sides. You're recording the mannequin also. All right. And as you go with your assessment, the idea is to explain the patient what you're gonna do. I'm not gonna do it all the time, but that's what you're supposed to do. And also, if you're gonna assess for tenderness, once you are doing it, you can distract the patient with conversation or with questions, and then you can assess for the tenderness. All right. So the first step for the assessment of the abdomen is the inspection. So you should inspect the abdomen. First of all, you're gonna expose just the whatever necessary area you need. And then, let's suppose this is a man. If it's a woman, I will cover her. Okay. So the inspection, you should do it from all the angles, not just from here. You should look around and move yourself so you can see, have a perspective of the whole abdomen. So you're looking basically for, you're gonna inspect the skin, if there is any mark in the skin, veins, or stretch marks, or ecchymosis. Also, you're gonna look for the contour of the abdomen, the size, the symmetry, and you're gonna look if there is any bulging, any distension of the abdomen, and also if there is a distension, you wanna determine if it's localized or is a generalized distension. Also, as you inspect the abdomen, you should look for any wave, pulsation, or it could be for the, a wave from the peristaltis. That can happen, for example, when they have like a gastrointestinal obstruction. Some area, the peristaltis could be increased, and you can see a wave. Also, you're gonna observe or look for pulsations, from the aorta, mainly from the vessels. And also you're gonna look for the whole respiratory pattern. All right, after you do the inspection of the abdomen, the next step is gonna be, you're gonna do the auscultation. So for the auscultation, you're gonna auscultate two things. You're gonna auscultate bowel sounds, and you're gonna auscultate vessel sounds. So the whole auscultation, ideally you can start, you're gonna use, for the peristaltis, for the bowel sounds, you're gonna use the diaphragm of your stethoscope, and you can start at the level of the ileocecal bulb, which would be like around, I'm not gonna put it on my ears just because I'm talking, and it's around just slightly to the right and below the umbilicus. So you would start your auscultation right here, and then you're gonna just auscultate the whole, all the quadrants of the abdomen. So you expect to hear gurgling, which are like a high-pitched sounds, and you can expect to hear them at least 5 to 30 in 1 minute, or at least one every 5 to 15 seconds. So you go to all the quadrants and you're gonna hear a tympanic sound because it's full of air. And then if you don't hear those sounds in that time, you should listen for vowel sounds for at least 5 minutes. Okay, so that's for the vowel sounds. And then you're gonna switch and you're gonna use the bell of your stethoscope and you're gonna listen for the vessel sounds. So basically what you listen for is broods. Broods are like a switching sounds that occur when the blood flow goes against the walls of a dilated or obstructed vessel. So you're gonna check for broods and using your bell, you're gonna listen several spots. The main spot would be the aorta. You go to the left renal artery. You wanna auscultate the right renal artery, and also you wanna look for your iliac, right and left. All right, another thing that you're gonna listen about the sound of the vessels, you're gonna look for the venous horns, which are usually listened again with the bell, and you listen in the epigastric area and by the liver. That usually is a sound that is a soft pitch sound, and it occurs when there is a partial obstruction of the artery, and so that's how you can hear it. Also, you're gonna look for another kind of sound, again with the bell, over the liver area and over the spleen area. You're gonna look for this kind of sound that is like a grating sound, and they are called drop friction sounds. So you can hear those usually mainly during inspiration, and you can think about some kind of mass, like a cancer of the liver or the spleen. All right, so that's about the auscultation. The next step is gonna be the percussion of the abdomen. It's important before you start your percussion to ask the patient if the patient has any pain, any area of pain, and you will leave the area to the last. Okay, so the percussion of the abdomen, you're gonna percuss the whole quadrants, and mainly what you're gonna have is a tympanic noise, of course, sound, because it's mainly air. So when you're percussing over the organs, you know, if it's a solid organ, you're gonna have dullness. If not, you're gonna have, if it's air, you're gonna have a resonance, or if you have a liquid, you're gonna have tympanic sound. All right, so you percuss over the full 4 quadrants. So you're looking for tenderness, and basically what you evaluate with percussion is tenderness, and you evaluate the size of the organs also. So you do the general percussion of the abdomen, and now you go directly to percuss organs, because you want to look at the size of the organs or if there is any tenderness. So let's start with the liver. In the liver, you are going to start your percussion. You're going to start from the second or third intercostal space with the medial clavicular line. So that means you start on the lungs level, and you're going to start percussing downward. And once you start the resonance changes to a dullness, that means you're in a solid organ, you're going to mark it. You're going to mark it right there. I don't have the marker, but I had it somewhere. Okay, so you mark it here, which is usually at the level of the 5 and 7 intercostal space. So you mark right there. And then you're gonna come to the same medioclavicular line, but at the level of the diaphragm, I mean the sternum. And this time you're gonna percuss upward. So you start from a tympanic noise sound. You start gonna upward, and once you find your dullness, you're gonna mark it. So all the area of dullness would be the area of the liver, and you expect it to be between 6 and 12 centimeters. So that area of dullness going upward actually starts usually at the level of the costal margin. So it would be like from the 5 and 7 space, intercostal space, to the just right there by the costal margin, 6 to 12 centimeters. That's like the expected size of the liver. If you are down out of the 12 centimeters, you have an enlarged liver, and then you can go to you can measure from the same medial clavicular line, but at the level of the sternum, you can percuss, because the liver will be like that. And this percussion, you expect dullness no bigger than 4 to 6 centimeters. If you're bigger than that, then you have an enlarged hepatomegaly, an enlarged liver. So that's how you percuss your liver. Now you can do percussion of the spleen. There are 3 ways to percuss the spleen. You can go from the left medial clavicular line, and then you go from the costal edge, and then you go to the medial axillary line. So you're gonna percuss all the way. The other way would be like from the second to third intercostal space in the anterior medial line. You're gonna percuss down. And then when the patient is doing inspiration, if you find dullness here, that means that you have an enlarged spleen. All right, there is another way, I don't remember right now. But that's the percussion of the spleen. I'm missing one way. All right. Another organ that you can percuss is the bladder. So the bladder, you go to the hypogastric area or region, and then just right above of the pubic symphysis. You're going to start percussing upward up to the umbilicals. All right, so you percuss. I asked the patient to empty the bladder before, so you can find a little bit of tympanic, which is all liquid. But what I said about the empty the bladder before is I missed something before, which was after you do the inspection, before you do the auscultation, what you can do is a bladder scan. So you place the scanner right here below the pubic symphysis, and then you set it up for male or for woman, and then you take like 3-4 pictures. And also what I was gonna say is that if it's an empty bladder, you can even have 50 to 100 milliliters of urine there. But if you find like 200 milliliters or more, that's a sign that there is inadequate emptiness of the bladder. I mean, the patient has problems emptying the bladder. All right, I just remembered that point now. The other organ that you can percuss is the kidney. So for that way, what you're gonna ask is the patient to sit. So you gotta go here. So the way you're gonna percuss the kidneys, you're gonna place the non-dominant hand. You're gonna put it in the costovertebral angle. That's where the ribs get together with the vertebral column. You put it right there, and with your dominant hand, you're gonna